This is a stitched-together compilation of TikToks explaining why some believe the US is heading toward collapse. I don't own these clips. This is purely for educational and awareness purposes.
How much of our drug supply is controlled by China?
We're so dependent on China that if they shut the door on sending medicines to us, our hospitals would shut down within a couple of months.
In the case of some drugs, like antibiotics, China has a total stranglehold.
We can't make penicillin anymore. The last penicillin plant in the United States closed in 2004.
So I work in healthcare, and Hong Kong just announced yesterday that they were completely stopping all postal service to the United States.
Who did that?
Hong Kong.
Hong Kong, okay.
And we get 50% of all of our medical supplies and 91% of our medications from China. So hospitals are going to close.
Yeah.
What immediate action will you take to stop this? Hospitals are going to be immediately crippled as soon as next week.
The news broke that pharmaceutical tariffs are on their way later this month. And what I'm not hearing enough of is how this impacts disabled people. Many of us rely on medications to keep us alive, and the only option is for those medications to come from overseas. And if you're on federal disability, there's no increase in your income to pay for these tariffs on pharmaceuticals. And if you're on SSI, you can't have more than $2,000 in your bank account. So it's not even like you could save up or have a GoFundMe to pay for the increased cost of your medications. Tariffs on pharmaceuticals are literally a death sentence for disabled people.
Donald Trump's 2025 tariffs are affecting everything from hammers to automobiles. How is it going to affect your healthcare? I'm Dr. Hassan. Let's dive into it, see what industries are affected, and then predict what I think is going to happen in the future. Starting off with the first industry, pharmaceutical industry, a lot of the raw materials used to make your medications, they do come from overseas. Now, they do end up going to factories in the UK or the US where they are processed and turned into medications, but the raw materials that are necessary to make those medications do come from overseas. A lot of the time from China and Mexico. The med tech companies, now I'm talking about pacemakers, defibrillators, your knees and shoulders, a lot of their products come from overseas, specifically Mexico. That means the tariffs are going to make those products cost more. And finally, the hospitals buy a lot of their products from overseas, especially China, Indonesia, and Vietnam. I'm talking about your syringes, your IV bags, and the blankets that you wear in the hospital. What do I think is going to happen? More than likely, a lot of these corporations are going to front run the tariffs, so they're going to buy up additional supply. That means that you're going to be able to get your diabetes medications or your shoulder replacements a lot more readily in the next 3 months. However, if the tariffs are not taken away in the next 3 to 6 months, your medications are going to cost more, your shoulder surgery is going to cost more, your knee surgery is going to cost more because the raw materials necessary to make those medical devices or medications are going to cost more. Hospitals across the country run very thin profit margins. They're not like tech companies. They usually run a profit of 2 to 5%. Unlike health insurance companies, which run profits of 20, 30%, hospitals run very thin margins. So it's going to affect the entire industry. And I'm just guessing, but more than likely your insurance costs are going to go up and they're probably going to stay up.
Okay, so we need to have a serious conversation to this tear-off that is happening between China and the U.S. because to respond to America for giving 104% tariff now, China has raised theirs to 84% on us, and this is going to affect us heavily if this keeps going. And I feel like everyone's talking about everything stupid it's affecting. This is going to affect hospitals. I mean, ridiculously. I mean, minus the tech that they get, right? Like the computer screens and all the technology to do the surgeries and things like that. These are like just everyday things they use. And I'm just talking about the basics like gloves, cleaning supplies, stethoscopes, anything. Everything. It's going to affect the hospitals heavily. Like, think about this, right? The hospitals, the major countries they use to actually get their supplies from are Germany, China, Japan. Like, Japan and China right now are like tariffs. We'll just give you more. And that's such an insane thing to think, right? Like, you could go to a hospital and they might not have any kind of sterilization equipment to get a room ready to save someone's life because the hospital is trying to cut costs, not make more costs, so they'll downgrade on some of the things they get. Trump needs to stop this pissing contest that he's having with China currently at the moment because this is pride. He won't let it go because he doesn't want to show that he's the weaker person. But he needs to let it go because this is affecting the people he swears he cares about and wants to protect. He's not doing either. We're dying over here, can't survive, and now it's getting worse because now you're taking away from hospitals. This is stupid. Stop it.
And I can tell Americans are ignorant because
Every time I mention tariffs, people are only thinking in terms of retail. They're thinking of terms of, oh, well, we can do without auto supplies, and we can do without eyelashes, and we can make do with the food shortage in the grocery stores. What about the medical supplies? Where do y'all think the gauze comes from? The Band-Aids, the IV bags. Okay? If the tariffs go up, you'll also may incur those charges if you're on Medicare and Medicaid. And people know most Medicaid patients or recipients and Medicare recipients, typically for a lot of generic brands, they don't pay out of pocket. Well, you're going to have to start paying out of pocket. Yeah. Because you're going to have to incur those tariff charges, those tariff taxes. So I just want people to think outside of that little bubble that Americans think in, because Americans tend not to think outside of certain parameters, that the tariffs don't just impact retail sector. It impacts, essentially, it's a domino effect. So if you go to get some emergency care treatment, you go to a day emergency clinic or whatever you call it, urgent care, they may not be able to supply you with certain things. They may not be able to medicate you with certain medications unless it's urgent or an emergency or something like that. Even think of things like asthma medication. Like that is what we're facing. But people don't think in terms of that. They just think retail. I can do without TV. I can do without video games. Of course you can. It's the essentials that you can't. And those will be impacted too.